everyone, we are Team AWAN and now we are going to represent our project about
mental health-based suicide in ASEAN countries.
So let's begin our presentation. Suicide is a global public health issue that is closely related to mental health. According to the WHO 2023, most suicide cases are triggered by mental disorders such as depression and anxiety and exacerbated by social and economic pressure. In the ASEAN region, factors such as unemployment, social inequality, and rapid urbanization also increase the risk. Therefore, this study used a machine learning approach Random Forest and XGBoost to analyze the complex relationship between socio-economic factors and suicide rates in ASEAN.
In this section, I'll explain the methodology of our study. First, let's start with the data. Our data were obtained from the World Development Indicator published by the World Bank covering the years 2010 to 2021. We include 10 ASEAN member countries. The variables analyzed include GDP per capita, GDP PPP, unemployment rate, school enrollment, hospital bed, health expenditure, and suicide mortality rate. Next, let's move on the method. The first step was mixing data imputation and scaling using the min-max scaler to ensure all variables were on the same scale. Then for the data analyzed, we applied two machine learning regression models, that is Random Forest regressor and XGBoost regressor. We also conduct a sharp analysis to interpret the contribution of each variable to the suicide mortality rate. Finally, for the model validation, we use 5-fold cross-validation with two main evaluation metrics. First, R-square and root mean square error.
Next, we will explain the result of the correlation analysis between social, economic, and suicide rates variable in ASEAN countries. First, we can see that GPT per capita and GDP PPP have a very high correlation of 0.99, indicating that both measure the same aspect, the level of economic prosperity. Next, GPT per capita and health expenditure also show a high correlation of 0.97, meaning that higher income per capita tends to lead to higher health spending.
In addition, hospital beds are positively correlated with GDP and health expenditure, around 0.72 until 0.76, which means wealthier countries tend to have better hospital facility. For school enrollment, the correlation with GDP is moderate, around 0.69, suggesting that stronger economy also encourage higher school participation. For school enrollment, the correlation with GDP is moderate, around 0.69, suggesting that stronger economies also encourage higher school participation. The sub-summary plot indicate that school enrollment and hospital bed have the greatest impact on the model output.
Next, we move to the final visualization. First, let's look at school enrollment. High enrollment rates in Singapore and Thailand reflect strong education system, but they also come with intense academic pressure. This can lead to higher levels of stress and mental fatigue among students. Second, hospital beds. Countries such as Singapore and Vietnam have a higher number of hospital beds, meaning they have better healthcare access and more accurate reporting of suicide cases. Third, the unemployment rate. In Brunei, unemployment is relatively high, but suicide rates remain low because of strong government support and social welfare programs. In Singapore, even with low unemployment, high living costs and job competition can still cause stress.
Fourth, GDP PPP or purchasing power parity. Singapore and Brunei have high GDP PPP, which reflects strong purchasing power, but it also brings higher economic and social stress. Countries with medium or low GDP PPP, such as Thailand and Myanmar, saw lower suicide risk, possibly due to stronger family and community ties. Fifth, GDP per capita. Countries like Singapore saw high economic prosperity, but this often comes with greater social expectation and pressure, which can increase stress and suicide risk. In Malaysia, the effect is more moderate due to balanced economic condition. Lastly, health expenditure in Singapore and Brunei hikes spending on health improve awareness and reporting of mental health issue. However, in Myanmar and Laos, limited health budgets restrict access to mental health care and proper reporting. That's all from us. Thank you for watching. We hope this presentation was informative and meaningful. Bye!